This health care is a path to socialism. Socialism is not something we need.
A health care forum in Monroe turns into a heated debate with angry voters addressing Congressman John Hall. Welcome back to Newsmakers. I'm Janine Rose. Today we're talking about the national health care debate, how the death of Senator Ted Kennedy this week plays into the discussion. Health care reform is certainly a polarizing issue, and on Thursday, more than 100 people showed up at a forum hosted by Congressman John Hall to make their voices heard about the options being considered in Washington. And as News 12's Blaise Gomez shows us, the discussion quickly became a heated debate.
You and Congress are trying to pass this massive government takeover of our lives called health care. Doesn't have to do with health, and it certainly doesn't have to do with care.
It was a public health care reform forum that at times turned into a battle.
What about the illegal?
This is a Jolly Seniors meeting. I realize that everybody, actually it's
I pay taxes. I pay for this.
and this is a Jolly Seniors meeting.
More than 200 concerned residents packed the Monroe Senior Center Thursday to question Congressman John Hall about government health care reform and get answers.
Where is the money coming from?
Do you really feel in your heart that this is the best for the people?
Will this affect my Medicare?
I want to vote to give all Americans the same choices and the same quality and, more importantly, the lower costs that we in Congress have.
Answering question after question for more than an hour, Hall said he supports a hybrid plan that keeps private insurance but provides choices for people who are uninsurable or can't afford coverage. And while some disagreed, others spoke out in favor.
I would so much prefer my health care to be in the hands of people who don't profit from denying me service.
Congressman Hall says he'll have to see a final version of the bill before committing to universalized health care, something the forum here clearly showed will likely remain a controversial topic for some time to come. We're in Monroe. Blaise Gomez, News 12.
Well, Congressman Hall's opponent for the 19th district seat in a battle already heating up for next year is State Assemblyman Greg Ball. Ball also held a health care forum in the form of a town hall meeting. He held his on Thursday night in Somers, and again, more than 200 people came out armed with their opinions to join the heated debate. News 12's Lisa Reyes was there.
This man, one of many lining up inside John F. Kennedy Catholic High School in Somers to voice his opinion about President Obama's health care plan. From veterans, seniors, and families, some are split on the plan, which estimated at $900 billion over the next 10 years. The White House says under it, most taxpayers will not have to foot the bill and Americans can keep private insurance. But confidence is dwindling here in the Hudson Valley.
A bureaucrat is going to decide what kind of health care we get, when we can get it, and they'll be rationing for sure. And for that reason, I oppose it.
Others say they want answers and details on how it will affect them, lobbying local politicians for help.
All I heard from the congressman was blah, 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 and then some more blah, blah.
Thursday night's host was Republican Assemblyman Greg Ball, who is now running for Congress. He says the purpose was to listen and bounce ideas around from the community.
To try to find a pragmatic, cost-effective solution where blue dog Democrats and moderate and liberal Republicans can come together and actually get something done.
Well, absolutely. The health care debate is sure to be an issue in next year's congressional race, particularly this one, which includes Westchester, Orange County, Rockland, parts of Dutchess, Putnam, etc., basically all of our viewing area. And again, we're talking to Mike Edelman and Lawrence Otis Graham today. And gentlemen, just to see how this is playing out in one congressional district, Lawrence, what does it leave you thinking in terms of, will this be a sticking point? Will it affect John Hall's ability to get reelected to a second term?
Well, one thing it shows me is that Greg Ball is using this to position himself as a moderate liberal Republican, which I find sort of shocking, and I think that anybody who's followed his career...
They know he tends to be conservative.
Exactly.
Yeah.
So I think one thing that he's definitely going to do is use this as a wedge issue, because in the past his issue has primarily been focused on illegal aliens, undocumented residents. So I think that, and there's a lot of scare tactics that are used on this whole health care debate, because there's this argument argument of, well, first of all, where is the money going to come from? And if the money is coming from our taxes, is it going to be used to provide health care, this great health care for undocumented aliens? So, and that is not at all what this plan is about. And I think that Congressman Hall's job is just going to be to educate the population. But he was there to listen to people, and it's unfortunate, like as I said earlier, that this whole Rush Limbaugh approach to talking about this issue is to brand it as socialism and also just create a situation where people are not even expressing their views. They're arguing and screaming at these town hall forums.
Do you think that Assemblyman Ball is kind of rabble-rousing at this point? Do you think he's sending his supporters into these
I think
meetings?
he is certainly fanning the flames because it serves his interest to do that.
Fanning the flames. Greg Ball understands, he has his finger on the pulse of the people in that congressional district. And when the people in that congressional district elected John Hall, they did not expect John Hall to rubber stamp a nationalization of the health care system in the United States, which is what the President and Nancy Pelosi and the Democratic Congress is stuck advocating. Greg understands, and by the way, on the issue of illegals, Greg has only addressed that problem with respect to the kinds of DWIs that have been going down in Brewster, where you've got criminal illegals charged with crimes. Let me finish. Charged with crimes, okay, and the sheriff doesn't call the ICE hotline and detainer warrants don't get lodged. But that's Greg. But Greg is smart because Greg understands that the issue is of concern, this healthcare nationalization issue. It's not, forget about the word socialism, it's the loss of control. He does not want, nor do the senior citizens, people that are baby boomers that are going to be senior citizens that will be on Medicaid, they do not want to cede the control over their Medicare to some bureaucrat sitting in Washington who has no idea about what they need. Their doctor knows what they need. Greg understands
but if you listen to what Congressman Hall said, he suggests a hybrid program. He was not saying rubber stamping some Nancy Pelosi program as you were defining it as being. So I think that it's unfair for you to be saying that he's rubber stamping a program that others are suggesting.
Well, he hasn't spoken out except under the pressure of this hearing. He's gone along with what the Democrats who are in control of the Congress have so far given to the Congress. Greg understands
the
opposite.
Presented a proposal that's even viable.
What the Republicans are doing,
standing by criticizing what the Democrats
and they should be criticizing it because the proposal as it now stands. Well, that's what Greg said. Moderate Democrats, moderate Republicans, and blue dogs get together. And yes, he is. He's moderate centrist.
But let me ask you, Michael. But to the point is, are we stuck now with this plan that's on the table,
No.
Lawrence? Because to hear Hall, Congressman Hall is saying we've got to allow private insurance companies to continue.
Absolutely.
But yet, you know, how does all that come together? I mean, is it the president who says, okay, here's a plan that we can all agree on?
It's going to have to be the president that's going to step forward because, unfortunately, we don't have, in losing Senator Kennedy, who was the biggest proponent and the person who was giving the voice and the name to this issue, we don't have that person. It's going to be President Obama, who recognizes that there's too many people against this program as it stands. But he's not going to simply drop it because ultimately he wants everyone to have access to health care.
He certainly campaigned on getting health care in place.
He's always said he was for a single-payer system, which is the government. And the fact of the matter is, he said that when he was a senator, he said that when he ran for office, that was his preference, but it would take several years to get there. The people of that congressional district, and I dare say most people in the United States of whatever stripe, except very left-leaning Democrats, do not want the government making decisions.
We're
very simple.
Quickly running out of time. Let me ask you both. Does President Obama get a national health care plan passed in this first four-year term, Lawrence?
I think he will, but I think it's going to be substantially different. I think it's going to be more like the hybrid program that Congressman Hall was talking about.
I think the president will get something if he gives up the public option, if he gives up the end-of-life panels, and if he understands that if you want poor people to get covered, give them a tax subsidy, give them a tax break, or pay their premiums to private companies.
Gentlemen, on that note, unfortunately, we are out of time, and certainly this health care debate is not going away